Honorable Governor sir, Secretary sir, Assistant Secretary sir, and all TB Association President, Secretary, and Patron and other members, I welcome for this TB Seal campaign all the members. And before going to actual program, I want to enlighten briefly the Honorable Governor regarding the TB activities going on in the state of Andhra Pradesh. So, in the state of Andhra Pradesh, we have one state TB demonstration center and 26 district TB centers and 242 TB units, and almost 1580 TB4 and 13 DRTB centers, and we have molecular testing with TrueNat in 749 centers. So coming to key performance, actually we are testing around 2,450 per lakh population tests during this year, sir, and we could able to identify 55,245 TB cases in this year so far, and TB notification rate is in the state of Andhra Pradesh 156 per lakh, sir, and all the TB patients will be tested for HIV. 100% their HIV status we came to know, and around 4% positive cases are there identified, both TB and HIV, sir. And treatment success rate, we are the state of Andhra Pradesh continuously achieving more than 90% success rate since 5 years, sir. And all the TB patients will be tested for diabetes also, and 99% of cases diabetic status also we came to know. And in the TB patients, almost 13% patients are having both diabetes and TB. So meanwhile, contact tracing also we are doing, sir. For less than 5 years children, almost 10,086, 83.5% cases we would able to identify. And under universal DST for bacteriologically confirmed cases, 88% we are able to achieve, sir. Coming to present to TB examination, last year we have done more than 10 lakh tests, sir. This year so far we have achieved more than 10 lakhs, and we could able to identify almost 55,000 cases. So coming to TB notifications, so far our target is 1 lakh per year, sir. So far we could able to achieve 66,666 cases. TB notification outcomes also, as I already told, the state of Andhra Pradesh is achieving 94% success rate in this year, sir. Adult BCG vaccination, one of the preventive program in the TB, sir. So it is a programmatic study program which will be conducted in 12 districts of Andhra Pradesh, and both district TB officers and DAOs closely monitoring this program. We are the #1 state in adult BCG vaccination, sir. Even though we started in the month of May, we could able to achieve so far 22 lakhs above vaccination for adults, sir. Likewise, in the adult BCG vaccination also, we have done 22 lakhs 40,397 vaccination coverage so far, sir. Under PM TB MBA, next. Under PM TB MBA, this one is the Pradhan Mantri TB Mukt Bharat Abhiyan. We could able to identify 3,641 Nikshay Mitras, and so far we have distributed more than almost 2 lakhs food baskets for the TB patient. This is in addition to what the government is providing, sir. This is under SBI and Power Grid, and so many companies under CSR program they are giving these food baskets. So far Andhra Pradesh achievements coming to, this is the second best performing state under category of more than 50 lakh populations, and we are the #1 state providing upfront molecular testing, sir, and success rate consistently more than 90%, sir. State is having a low death rate in TB patients, that is 1.9%. Actually permissible limit is up to 4%, but we are less than that. And subnational TB free certification also, we have got 1 gold and 2 silver and 5 bronze medals for the different districts in the year of 2022, sir. In the year 2023, under Pradhan Mantri TB Mukt Panchayats, so far out of 15,000, we could able to achieve 721 panchayats TB free, sir. Good practices what we are following is, in the year 2023 October, we could able to, in 1 month, we have transported 1,75,300 samples from rural areas and identified 527 patients early without any symptoms. Likewise, adult BCG vaccination also one of the flagship program, and the state of Andhra Pradesh is having a APSRTC logistics drug transportation with for smooth transport of drugs from the state to districts and from the districts to treatment units, sir. Thank you, sir.
Good morning, everybody, sir. I am Dr. Kodali Ramakrishna, Vice Chairman of the Association, presenting the activities of the Tuberculosis Association of Andhra Pradesh. As Vice Chairman, our Honorable Governor and beloved President of the Association of Andhra Pradesh, TB Association, Sri Justice S. Abdul Nazeer Garu, and dignitaries on the dais and off the dais, very good morning to you all, sir. I am happy to inform that the Tuberculosis Association of Andhra Pradesh was established in the year 1957. The main objects of the association is to assist in the control of tuberculosis through its district branches by supplementing and complementing the efforts of the state and central governments in the implementation of the National Tuberculosis Elimination Program. Some of the highlights of the activities taken up by the association are: the association is extending financial assistance to poor multi-drug resistant tuberculosis patients by giving 500 rupees per month to 10 patients in each district in Andhra Pradesh, and 2 institutions, that is AMG International, India International, Chilkulurpet, Guntur district, and Arogyaram Medical Center, Madanapalli, Chittoor district, by transferring the amount directly to the patient's bank accounts. Refresher courses and CME programs for the doctors, post-grad students, and paramedical staff in the districts. The association has transferred a sum of 1,30,000 to the district TB associations and institutions for organizing the activity. 5% of the rent is being set aside exclusively for providing financial assistance to the poor multi-drug resistant tuberculosis patients. Last but not the least, the association is prepared to take up part in NTEP, National Tuberculosis Eradication Program, to strengthen the government of Andhra Pradesh in the control of tuberculosis problem. Thanking you one and all.
Jawaharlal ji, Secretary to the Governor, Dr. P.S. Sarma, Patron, TB Association of Andhra Pradesh, Dr. T. Ramesh, Joint Director, TB Control Officer, ladies and gentlemen. ఈ కార్యక్రమాన్ని విచ్చేసిన అతిథులు, సోదర సోదరీమణులు అందరికీ నా నమస్కారం. It gives me immense pleasure to be here on this solemn occasion of inauguration of the 75th TB seal sale campaign. It is almost 143 years ago since the positive organism of tuberculosis was first discovered by Sir Robert Koch in 1882. Tuberculosis continues to be a killer disease, and the spread of TB has become a cause for concern even in the developed countries. The World Health Organization has declared the tuberculosis as global emergency. as the most populous country in the world, India has a burden of almost 1/4 of the global TB cases. Very alarming, right? An estimated 25.37 lakh TB cases were notified in India in 2023. In olden days, there was really no cure for tuberculosis, and the patients were sent to sanatoria situated on the hills for treatment by giving high rich protein diet to increase the resistance of the patients. I am aware of this personally because very close to my house in Mangalore, there is a hill, and we used to call them a TB center, and nobody were allowed to go near because of the infection. It was completely closed. It was on a hilltop. I remember, we used to, every day while going to school, colleges, we have to go via that road, and a kind of fear, we were a bit afraid to walk even on those roads. And I used to see the patients, slim and all, coughing, always coughing. We are not allowed to get into that campus also. The discovery of several effective drugs has given a hope of recovery from the dreaded disease amongst the patients. According to the Global TB Report 2023, released by the World Health Organization, India has made tremendous progress in improving case detection and reversed the impact of COVID-19 on the TB program. The treatment coverage has improved to 80% of the estimated TB cases, which is an increase of 19% over the previous year. India's efforts have resulted in reduction of TB incidence by 16% in 2022 from 2015, almost double the pace at which global TB incidence is declining, which is 8.7%. The mortality of TB has reduced by 18% during the same period in India and globally. It is estimated that a total of nearly 1 lakh people are suffering from this dreaded disease in Andhra Pradesh alone, even now. It is heartening to note that the success rate in the recovery of patients from TB in our state is 91%. I am also told that Andhra Pradesh has shown exemplary efforts in addressing TB HIV co-infections with a number of diagnosed patients receiving appropriate care and support. They were put on necessary preventive therapy, and comprehensive management strategies are adopted aimed at improving patient outcomes and reducing mortality rates. I would like to recall the statement of our Honorable Prime Minister, Sri Narendra Modi ji, who said, and I quote, "The global target for eliminating TB is 2030. But I announced that the target for India to eliminate TB is 2025, 5 years before the global target. And for its success, I think you have to take care, we have to take all actions in this line. Keeping this in view, Government of India has been implementing the program of End TB strategy. Voluntary organization like TB Association, Indian Medical Association, Red Cross, Lepra India, TB Alert, World Vision, AMG India International, and Arogya Varam Medical Center and others have a great role to play by supplementing the efforts of the state government in control of tuberculosis. I am happy to learn that the TB Association of Andhra Pradesh and its district branches are doing their might for control of TB ever since its inception. in the field of health education and participating in the TB elimination program. I hope the efforts of Medical and Health Department, TB Association of Andhra Pradesh and their district branches will bear fruit in reducing and finally eradicating the spread of TB disease in the state. I appeal to everyone to contribute generously to the TB seal sale campaign. Let us all join our hands together in the effort to eradicate tuberculosis in the country by 2025. TB हारेगा, देश जीतेगा. जय हिंद.
Now I request our Hon'ble Governor sir to distribute Shield Institutional Individual Award